This video of mine is about G6PD deficiency. Well, G6PD deficiency is a genetic disorder that most often affects males. It happens when the body doesn't have enough of an enzyme called glucose 6-phosphate dehydrogenase, that is G6PD. G6PD helps red blood cells work. It also protects them from substances in the blood that could harm them. In people with G6PD deficiency, either the red blood cells do not make enough G6PD or what they do make doesn't work as it should. Without enough G6PD to protect them, the red blood cells break apart. This is called hemolysis. When many red blood cells are destroyed, a person can develop hemolytic anemia. This can cause tiredness, dizziness, and other symptoms. Red blood cells that do not have enough G6PD are sensitive to some medicines, foods, and infections. When these things trigger the quick loss of red blood cells over a short time, it is called a hemolytic crisis. In these cases, the symptoms stop when the cause is gone. In rare cases, G6PD deficiency leads to chronic anemia regardless of exposure to triggers. Triggers of hemolysis in kids with G6PD deficiency include illness such as bacterial and viral infections, some painkillers and fever-lowering drugs, some antibiotics, most often those with sulf in their names, sulfur drugs, some anti-malarial drugs, most often those with quine in their names such as primaquine, chloroquine. Fava beans, also called broad beans, naphthalene, which is a chemical found in mothballs and mouth crystals. Mothballs can be very harmful if a child swallows one. Now I will tell you the signs and symptoms of G6PD deficiency. Well, most people with G6PD deficiency do not have any symptoms. Others might have symptoms of hemolytic anemia if many red blood cells are destroyed. These can include paleness in darker skin kids. Paleness is sometimes best seen in the mouth, especially on the lips or tongue. Extreme tiredness or dizziness, fast heartbeat, fast breathing or shortness of breath, jaundice, in which the skin and eyes look yellow, and enlarged spleen, dark tea-colored pee. Mild symptoms usually do not need a medical treatment. As the body makes new red blood cells, the anemia will improve. If symptoms are more severe, a child may need care in a hospital. Now I'll tell you the causes of G6PD deficiency. Well, G6PD deficiency is inherited. Children who have it are born with it because it was passed down in genes from one or both of the parents. The gene responsible for this condition is on the X chromosome. G6PD deficiency is most common in males of African heritage. Many females of African heritage are carriers of G6PD deficiency. This means that they can pass the gene for the deficiency to their children but do not have symptoms. Now I'll tell you about the diagnosis of G6PD deficiency. Well, G6PD deficiency often is not found until a child gets symptoms. If doctors suspect G6PD deficiency, blood tests usually can confirm the diagnosis and rule out other causes of anemia. If you worry that your child might have G6PD deficiency, talk to your doctor about a screening test to check for it. Now I'll discuss the treatment of G6PD deficiency. Well, treating G6PD deficiency symptoms is usually as simple as removing the triggering factor. Often this means treating the infection or stopping the use of a drug which is causing these symptoms. A child with severe anemia may need treatment in the hospital to get oxygen and fluids. Sometimes the child also needs a transfusion of healthy blood cells. Now I'll advise the parents what they can do. The best way to care for a child with G6PD deficiency is to limit exposure to anything that triggers symptoms. You should check with your doctor for instructions and a list of medicines and other things that could be a problem for a child with G6PD deficiency. Well, if you see the images on in this video, I will list a number of drugs and other substances that may cause G6PD deficiency. So you should note down all these. Well, with the right care, G6PD deficiency should not keep a child from having a healthy and active life. Well, this was my video about G6PD deficiency. I hope you like this video. If you have any questions about G6PD deficiency, you can post your question in the comment section. And thanks for watching this video. See you in next video. Bye for now.